I want to talk about, I want to tell a story. So, over a decade ago, I had completed a program at George Brown College where I had studied mental health and addictions counseling. One of my first real jobs in the field was working in a day treatment program for youth who'd experienced first episode psychosis. I managed a small group of young people, about 7, the majority of which were people of color, young men of color, mostly African and Caribbean. I was the first and the youngest black staff hired in that program to do that work. Most all of the young people of color were sent to me. I built a relationship with one of my clients who had struggled with mental health issues for some time. In fact, his whole family had. His parents, too, had struggled with severe mental health issues, and he had moved through the criminal justice system and eventually came to us. That young man bumped into me a couple of years ago on a subway platform. And I was a little taken aback, but we got into a conversation. And he shared with me that he remembered me from all those years ago. And in fact, he remembered a particular counseling session that had happened that I was involved in. I was green, right out of school. I was making it up on the fly. And if I was even more honest, I was pretty triggered. When I looked at the young man in front of me, I saw an echo of myself. When I looked out into his family, I saw an echo of mine. And so in that counseling session, I was really counseling myself and my family. Mental health has been a struggle within my family for quite some time. I've been impacted by mental health in my younger years as well. If I had not become a worker, I probably would have ended up becoming a client. The reason why I hadn't was all down to the intervention of some key individuals. This particular young man then shared with me that because of that relationship built, he had gone on to study social work himself, actually at the same school that I had. And he remembered really vividly that intervention. And a lot of that, I think, came down to the fact that he saw mirrored in me himself. That it wasn't sort of this top-down sort of intervention, it really was across the table. My mother talks about the importance of across the table, around the table. That conversation is really essential to health and healing for communities of color. Donna spoke about the fact that there is research that shows that the mental health outcomes for people who recently migrated to Canada increases in terms of its difficulty once arriving. That the systems of support that exist for people in their communities of origin don't exist here. That for many people of color, particularly African and Caribbean communities, many of us are thrust immediately into modes of survival. That when faced with vertical and lateral violence, right? So we know vertical violence in terms of institutional and systemic racism, right? That's that top-down stuff, the stuff that you hold on your shoulders. But what we don't talk about is also the violence that then occurs amongst ourselves as victims of violence. And it's interesting, and I'm a lecturer, so I feel like I want to get up and write it down on the whiteboard, but when you draw it out, you come up with crosshairs. That many young people who are experiencing that placement at the crosshairs of both systemic and institutional violence, racism, discrimination, and intra-community violence and harm and trauma, that you've got a young person in crosshairs. And whenever we see crosshairs, we know that somebody's about to get shot. I also do work around spiritual care. And a number of years ago, I founded a ministry called Sunset Service Toronto with a mission to really outreach to marginalized, racialized folk, oftentimes folk who've been excised out of their communities of origin and their faith communities of origin, and provide them with support and care and a space to be. Many, many, many young people have come through our doors. many, many people in general have come to our services and have spoken to us about the very process of being witnessed. So, for those of you who come from a particularly religious or spiritual tradition, perhaps Judeo-Christian, you'll hear the term, "Can I get a witness? Can I get a witness?" So, it's interesting because before the formalization of the mental health system and care work, the work being done by professionals today was once done by spiritual workers, healers, and ministers, and pastors, and root workers, and obia men. That spiritual care is mental health and emotional care in its most basic form, in its most primal form, because it's a care that takes care of the whole person. Since returning, I've recently moved back from time abroad. I lived in the UK doing work with children in care and at risk of care, particularly marginalized families. And since I've returned, I've attended 2 memorials for young people of color, African Caribbean people who've committed suicide. In the community, I've heard of 3 incidences of death by suicide. Some of these young people were within the LGBT community, and that's another intersection that doesn't always get acknowledgement, but it must be recognized that a number of young people who are struggling with mental health issues are also LGBT folk. And I talk about this with my students all the time to avoid the incidents of looking out and seeing our clients as pathologies, right? It's awesome to get an education, but sometimes the fault that we fall into is our educations, right? We see through textbooks, and we don't see people. So I very often encourage my students to not see pathologies, but instead to see thermometers. That every young person and child that they engage with is actually a thermometer, gauging the temperature of the environment and the climate with which they exist in. That young person struggling with a mental health issue is not just some biomedical concern that must be addressed with the right medical intervention, but a whole person who's impacted by many systems. We all know our ecological systems theory. Yes? Yes? So we recognize that we all exist in systems, and those systems overlap. And many times when those systems are toxic or harmful, or aren't meeting the needs that we have, that we respond in kind. And I think mental health and poor mental health actually is a response, right? I think we've begun to see it as a deficit in individuals, right? Or something broken in people. But actually we have to understand that people are creative and innovative, and our minds and our bodies and our psyches also are. And that mental health actually is a response to a toxic situation, if not just for that individual and its family or community, for us as a society, right? As we've moved closer and closer towards this sort of mantra of individualism and self-actualization and self-realization and self and self and self, the harms that that particular ideology has on our people is being seen in the increasing amount of people of all races and backgrounds in institutions of mental health care. All of our work is to address some of those systems that result in what we see today as the overrepresentation of Black children and youth. Thank you.
Well, good afternoon, everyone. This certainly is an important topic. Before I begin, I want to just acknowledge some things here. President and CEO is here. Is that correct?